Good evening. The U.S. is currently in the beginnings of what is being billed as the largest man-made epidemic in history. What I'm talking about here is the prescription or overprescription of painkillers, specifically opioids. When I'm talking about opioids, I'm talking about Oxycontin, oxycodone, hydrocodone, codeine, morphine, Dilaudid. Those are the main ones. To get an idea of the size of this, you have to look at the numbers. First off, drug overdose is the leading cause of accidental death in the United States. 50,000 people a year will die of an overdose. Prescription painkillers accounts for well over half of that number. It's estimated around 2 million people are addicted to prescription drugs. Interestingly, 4 out of 5 people that are new to heroin came to heroin via prescription painkillers, so it's a major gateway. In the last 10 years, the death rates and the addiction rates have quadrupled, and this is what's led to this being an epidemic. Congress has responded. It's gotten high enough level on this that Congress has responded by passing legislation earlier this year, and they're seeking over $1 billion in funding to combat the epidemic. Now you could ask, like, who are these people that are addicted or dying? And for the large part, for the most part, they are ordinary people that went to their doctor for chronic pain. They are not your idea of a drug addict standing out on a corner looking rather seedy. That's not who they are at all. How did this happen? Where did it come from? It's complex, but everybody's pointing at the large pharmaceutical companies that they had aggressive marketing to deal with, so that they could sell more opioids for chronic pain, and they've been very successful at it. There was a lot of well-meaning healthcare providers that were trying to do the right thing for their patients as well, and it hasn't quite worked out that way. What's being done about this at the moment? Well, the government, of course, has stepped in. There's increased regulations on healthcare as to who can provide opioids and in what quantities and what opioids they can put out. As well, there's been education as far as pain management is concerned. You're seeing pain specialists and clinics spring up. There's clinics which are to deal with. They're there to deal with. They're treatment centers for addiction. At an individual level, though, the healthcare providers, you're seeing many of them that are opting out of. They are refusing to prescribe opiates, and you'll continue to see more of that. But let's talk about the root cause here for a minute. A couple of decades ago, pain was made the fifth vital sign, and the public was educated that pain was something that they didn't have to deal with, or they shouldn't have to deal with. While this is good in theory, what happened was that any pain required medication, and because pain is subjective, the healthcare providers had no way of telling whether the pain you had actually required medication or not. As a society, we started to equate the lack of sensation with being healthy, and that may not be quite productive. Hospitals and providers were assessed on how well they managed this discomfort, your discomfort, when you went in to see them, rather than how well they cured the underlying condition. And we're seeing more of that. To conclude on this, the opioid epidemic is the largest man-made epidemic in history, and if you haven't heard of it, you will be hearing about it. While you can point at the government and big pharma and the healthcare providers as being the cause of it. I would suggest that our individual beliefs about what constitutes health is both the root cause and therefore the eventual solution to this problem. Think carefully before you pop that little white pill. Good night.